Most all therapeutic drugs are enzyme inhibitors, from old medicine box standards such as aspirin and penicillin to the newest compounds used to treat HIV infection. Understandably, enzyme kinetics plays an outstanding role in this effort to produce effective therapeutics, for kinetic studies can quantify the degree that inhibitors inactivate or slow down the targeted enzyme's catalytic rate and describe its potential efficacy as a drug. In addition, many naturally produced toxic substances and chemical warfare agents are also enzyme inhibitors. For example, a peptide found in snake venom became a lead compound in the development of a class of hypertension drugs that inhibit angiotensin-converting enzyme, or ACE inhibitors. The nerve gas sarin is a potent inhibitor of an enzyme important for synaptic transmission in nerve tissue. Enzyme inhibitors alter the activity of an enzyme by decreasing the enzyme's ability to bind substrate, lowering its catalytic turnover, or both. There are two main classes of enzyme inhibitors, reversible and irreversible, that are differentiated by their magnitude of their affinity for enzyme. Reversible enzyme inhibitors bind and dissociate with their enzyme in an equilibrium process. Irreversible inhibitors bind tightly to an enzyme to form an essentially permanent complex. Because they form such a tight complex with enzyme that they permanently remove its catalytic activity, irreversible inhibitors are also termed inactivators. For example, kinetic studies on the male pattern baldness drug finasteride, or Propecia, reveal it to be an essentially irreversible inhibitor of the 5-alpha reductase. This enzyme catalyzes one step in the conversion of testosterone to dihydrotestosterone, which is a hormone implicated in hair loss. Some irreversible inhibitors even become covalently bound to amino acids in the active site of the enzyme, as they are brought through the early chemical steps of catalysis. Aspirin is such an example. Reversible inhibitors can be classified as competitive, mixed, or non-competitive inhibitors. If the detailed mechanism of inhibition is known, then the classification can be made by identifying where on the enzyme the inhibitor binds, or the order with which it binds relative to substrate. Alternatively, a determination of simple kinetic parameters can generally be used to classify the inhibitor. Competitive inhibitors compete with substrate for an enzyme's active site, lowering the enzyme's likelihood of binding substrate and slowing the observed reaction velocity. A mixed inhibitor binds to a site on the enzyme and interferes with both apparent substrate affinity and catalytic turnover, thus affecting both the observed Km and Kcat for the enzyme-catalyzed reaction. Mixed inhibitors do not bind directly in the active site and therefore do not block substrate binding, but instead bind at sites that can be proximal or distal from the active site. Mixed inhibitors can therefore bind to free enzyme prior to substrate, distorting the active site to a non-optimal conformation for catalysis. The inhibitor-distorted active site has trouble converting the substrate to product before it dissociates, resulting in a lowered apparent substrate binding affinity.